Welcome back to our channel. Today we have an exciting video for you focusing on lower back pain exercises. Many people suffer from lower back pain due to various reasons, and these exercises can help alleviate the discomfort and strengthen the muscles in that area. Let's get started. Exercise 1, Cat-Cow Pose. Host. The first exercise we're going to do is called the cat-cow pose. Start by getting on all fours, hands directly under your shoulders and knees under your hips. Inhale deeply and arch your back, gently lifting your head and tailbone. Then exhale and round your back, pulling your belly button towards your spine. Repeat this movement for about 10 repetitions. Exercise 2, Bridging. Host. Next we have bridging, which is great for strengthening the lower back and glutes. Lie on your back with your knees bent and feet flat on the ground. Slowly lift your hips off the ground, squeezing your glutes, and hold for a few seconds. Then lower your hips back down. Repeat this movement for about 10 repetitions. Exercise 3, Bird Dog. Host. Moving on to the Bird Dog exercise. Start in a tabletop position again. Extend your right arm forward while simultaneously extending your left leg straight back. Hold for a few seconds, then bring your arm and leg back to the starting position. Repeat with your left arm and right leg. Do this exercise for about 10 repetitions on each side. Exercise 4, Superman. Host. For the next exercise, lie on your stomach with your arms and legs fully extended. Lift your chest and legs off the ground simultaneously, squeezing your lower back muscles. Hold this position for a few seconds, then slowly release. Repeat for about 10 repetitions. Exercise 5, Child's Pose Stretch. Host. Lastly, let's finish off with a gentle stretch. Sit on your heels and slowly bring your forehead down to the ground, extending your arms forward. This stretch helps release tension in the lower back and promotes relaxation. Hold this position for about 30 seconds to a minute. Conclusion. Host, and that concludes our top 5 lower back pain exercises video. Remember, if you're experiencing chronic or severe lower back pain, it's always best to consult a medical professional. These exercises are great for general discomfort and strengthening the muscles, but individual circumstances may vary. Thanks for watching, and be sure to give this video a thumbs up if you found it helpful. Here are a few more exercises that can help with lower back pain. 1. Pelvic tilt. Lie on your back with knees bent and feet flat on the ground. Flatten your lower back against the floor by tightening your abdominal muscles. Hold for a few seconds and release. Repeat 10-15 times. 2. Seated forward. Bend. Sit on the edge of a chair with feet flat on the ground. Slowly bend forward from the hips, reaching for your feet or ankles. Hold for 10-20 seconds and then slowly come back up. Repeat a few times. 3. Standing back extension. Stand with your feet shoulder-width apart. Place your hands on your lower back and slowly lean back, looking up towards the ceiling. Hold for a few seconds and then return to the starting position. Repeat 10-15 times. 4. Knee to chest stretch. Lie on your back with knees bent and feet flat on the ground. Bring one knee towards your chest and hold it with your hands. Hold for 20-30 seconds and then switch legs. Repeat a few times on each side. Bridge pose. Lie on your back with knees bent and feet flat on the ground. Lift your hips off the ground, aligning your knees with your hips. Hold for a few seconds and then lower back down. Repeat 10-15 times. Remember to always listen to your body and consult a healthcare professional before starting any new exercise routine, especially if you have pre-existing lower back conditions. Lower back pain can have various causes, including 1. Muscle strain or sprain. This can occur due to improper lifting, sudden movements, or overuse of the muscles. 2. Poor posture. Sitting or standing for long periods with incorrect posture can put strain on the lower back. 3. Herniated disc. The discs between the vertebrae can bulge or rupture, causing pressure on the nerves and resulting in back pain. 4. Spinal stenosis. This is a narrowing of the spinal canal, which can put pressure on the nerves and cause pain. 6. Degenerative disc disease. As the discs in the spine age, they can lose their cushioning ability, leading to pain and stiffness. 7. Sciatica. Compression or irritation of the sciatic nerve can cause pain that radiates from the lower back down the leg. It's important to note that these are just a few possible causes, and it's always best to consult a healthcare professional for an accurate diagnosis and appropriate treatment. Treatment options for lower back pain depend on the cause and severity of the pain. Here are some common approaches. 1. Rest and activity modification, taking a break from activities that worsen the pain and gradually increasing activity levels as the pain subsides. 2. Exercise and stretching. Strengthening exercises for the core and back muscles can help support the spine and reduce pain. Stretching exercises can improve flexibility and alleviate tension. 3. Pain medication. Over-the-counter pain relievers like acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, can help reduce pain and inflammation. However, it's important to follow the recommended dosage and consult a healthcare professional. 4. Heat or cold therapy. Applying a heating pad or hot pack can help relax muscles and alleviate pain. Cold therapy, such as using an ice pack, can help reduce inflammation and numb the area. 5. Physical therapy. A physical therapist can provide specialized exercises, manual therapy, and other treatments tailored to your specific condition. 6. Massage therapy. Gentle massage can help relax tight muscles and improve blood circulation to the affected area. 7. Mind-body techniques. Practices like yoga, tai chi, and meditation may help relieve stress and improve flexibility, thereby reducing back pain. 8. In some cases, medical interventions like injections, spinal manipulation, or surgery may be necessary. However, these options are typically reserved for more severe or chronic cases. Remember, it's essential to consult with a healthcare professional to determine the most appropriate treatment for your specific situation. Yes, there are several natural remedies that may help alleviate lower back pain. Here are a few options. 1. Apply a cold or hot compress. Applying a cold pack or a hot compress to the affected area can help reduce inflammation and provide temporary relief. 2. Practice good posture. Maintaining proper posture while standing, sitting, and lifting can help prevent strain on the lower back. 3. Engage in regular exercise. Gentle exercises like walking, swimming, or yoga can help strengthen the muscles in your back and improve flexibility. 4. Try herbal remedies. Some herbal supplements, such as devil's claw, turmeric, or ginger, have anti-inflammatory properties and may provide pain relief. However, it's important to talk to your healthcare provider before starting any new supplements. 5. Use essential oils. Applying essential oils like lavender, peppermint, or chamomile topically may help relax muscles and reduce pain. Remember to dilute the essential oils with a carrier oil before use and perform a patch test to ensure no adverse reactions. 6. Get sufficient rest. Giving your body adequate rest and sleep can help promote healing and reduce pain. 7. Practice stress management techniques. Stress can contribute to muscle tension and worsen back pain. Engaging in stress-reducing activities such as deep breathing, meditation, or mindfulness may help alleviate symptoms. While these natural remedies may provide temporary relief, it's important to consult with a healthcare professional to address the underlying cause of your lower back pain and develop a comprehensive treatment plan.